Good morning. We have with us Dr. Osam Syed Mohammed, anesthetist and ICU critical care from AB Hospital, Bhopal. We welcome you to the Natco Pharma Specialty Studio this morning, and we look forward to listening to you for the advice you can pass on to the younger generation of doctors, especially those associated with critical care and bacterial resistance treatment. Doctor, what, as for you, have been the changes in the critical care management?
Over the last few years that I've been practicing critical care, there has been an increase in the number of resistance patterns that we see in 4 different infections. The number of multi-resistant organisms that we have started seeing has really gone up so much, which is a really big concern. And it's not unusual to see reports where every bug in front of it there is an R and there is no S. And we are wondering how to manage these patients. So it's really pathetic that way.
Great. Thank you for highlighting that. What is your advice to the young ICU doctors for them to enhance patient care?
Generally, the most important thing is to have the basics clear, not to forget the clinical aspect of managing patients. These days, what is happening is because there are so many gadgets and so many high-tech stuff hanging around in the intensive care unit, and people get attracted more towards them, especially the younger generation. They tend to get more involved with those gadgets and with the procedures. But what is most important, I believe, is to stay in tune with the basics of medicine and do the basic things correctly, because most of the intensive care is about common sense. It's not about high technology, about precision based medicine with the help of expensive tools. Most of intensive care, I believe more than 70% of intensive care is just sticking to common sense and doing the basic things correctly.
Great. Thank you for bringing that common sense point out. I think makes a lot of sense to that. What is the prevalence of carbapenems in your area of practice? What treatment options do you look at?
Well, carbapenem resistance is really very worrying, because a few years ago we used to think of imipenem as a solution to all the resistant bugs. Slowly, gradually, imipenem became resistant, and then we had meropenem. But now all the penems come out to be resistant most of the times. So this is really worrying and concerning. What needs to be focused upon is good hand hygiene and good isolation of patients who already have resistant bugs, so that we don't spread those organisms to the other patients. I think that is one of the biggest cornerstone of managing such patients. Obviously, there are new drugs coming up as well for managing such patients who have got resistant organisms growing in their system. So yes, those antibiotics are important as well. But more important than that is to pass on those resistant bugs to other organisms, to make sure that we are not doing harm to the patients who are coming to us to be treated well.
Oh, very valuable insights, Dr. Osam, and we thank you for spending time with us in the studio. We wish you all the best in your practice. Thank you.